Globally, nearly 1 million young adults between the ages of 20 and 39 are diagnosed with cancer, and more than 350,000 people in this age range died from cancer in 2012. Cancer in adolescents and young adults is cancer which occurs in those between the ages of 15 and 39. Cancer is when cells begin to grow out of control. Cells in nearly any part of the body can become cancer, and can then spread to other areas of the body. There is no strict definition of what separates childhood cancers from cancers in young adults, or when exactly a person is no longer a young adult. Most cancers occur in older adults. But if cancer occurs in young adults, its treatment may become difficult and challenging. Some of them are genetically predisposed. Some of the most common cancers in young adults are breast cancer, lymphomas, non-Hodgkin and Hodgkin, melanoma, sarcomas, cancers of the female genital tract, thyroid cancer, testicular cancer, colorectal cancer, brain and spinal cord tumors. For example, lymphomas are more common before age 25, whereas breast, cervical, and colorectal cancers become more common after age 25. Breast cancer, more common after 30. The most common sign of breast cancer is a new lump or mass that's often hard and painless, although some cancers are soft, tender, or even painful. Young women often have breast lumps that are not cancer. Other possible signs of breast cancer include breast pain or swelling, thickening of the breast skin, changes in the nipple, or fluid, other than milk, leaking from the nipple. Adolescents and young adults with breast cancer generally have a worse prognosis than older women. No matter what age a woman is, breast lumps and other changes need to be checked by a doctor to be sure they are not breast cancer. Lymphomas can cause different symptoms depending on where the cancer is. Symptoms may include weight loss, fever, sweats, tiredness, and swollen lymph nodes under the skin in the neck, armpit, or groin. There are two main types of lymphoma: Hodgkin lymphoma, non-Hodgkin lymphoma. Both types can occur in young adults. Some of the types seen more often in young adults tend to grow quickly and require intense treatment, but they also tend to respond better to treatment than NHL in older adults. Melanoma is a type of skin cancer. Melanoma is one of the most common cancers in people younger than 30, especially younger women. The most important warning sign for melanoma is a new spot on the skin or a spot that's changing in size, shape, or color. Soft tissue sarcomas. Symptoms depend on where the sarcoma starts, and can include lumps, which might or might not cause pain, swelling. Bone sarcomas. They often cause bone pain that gets worse at night or with activity. They can also cause swelling in the area around the bone. Osteosarcoma usually starts near the ends of the leg or arm bones. Cancers of the female genital tract, cervix and ovary. Cervical cancer tends to occur in midlife. Most often it is found in women younger than 50. It rarely occurs in women younger than 20. Most cervical cancers can be found early, or even prevented, with screening tests. Vaccines against HPV, the virus linked to most cervical cancers, can also help prevent it. The most common symptom of cervical cancer is abnormal vaginal bleeding. Thyroid cancer. The risk of thyroid cancer tends to go up as people get older, but it's often found at a younger age than most other adult cancers. It's much more common in women than in men. The most common symptom of thyroid cancer is a lump in the front of the neck. Most thyroid lumps are not cancer, but it's important to have them checked by a doctor to be sure. Other symptoms of thyroid cancer can include pain or swelling in the neck, trouble breathing or swallowing, and voice changes. The chance of curing these cancers is usually very good, especially in young adults. Testicular cancer. Testicular cancer most often develops in younger men. About half of testicular cancers occur in men between the ages of 20 and 34, but it can occur at any age. Most often, the first symptom of testicular cancer is a lump on the testicle, or the testicle becomes swollen or larger. Some testicular tumors might be painful, but most of the time they are not. It's important to have any lumps checked by a doctor as soon as possible so that the cause can be found. In general, the outlook for testicular cancers is very good, and most of these cancers can be cured. Colorectal cancer. Cancers of the colon and rectum are much more common in older adults, but they can occur at younger ages. Adolescents and young adults tend to have poorer cellular differentiation, means it's hard to treat. Often, colorectal cancers are found at more advanced tumor stages in young adults. Symptoms of colorectal cancer can include rectal bleeding, dark-colored stools, changes in bowel habits, belly pain, loss of appetite, and weight loss. Among young adults, the outlook for these cancers tends to be better in those who are older at the time cancer is found.